So this video is going to go over the lower appendages, beginning with the femur. Okay, so first I want to talk about how you determine right femur from left femur. Okay, so don't look at the left. On a test, you may be asked to determine which side is this bone from. Is this right or is this left? First thing you have to do is to determine, are you looking at it from anteriorly or from posteriorly? Is this the front view or is this back view? Okay, in other words, are you looking at the person's front or the person's back? Okay. So you have to be able to pick out, right, the best way to look at it is look at this fossa. Okay. So the intercondylar fossa is located posteriorly. So that's what tells me this is the posterior view. This is the anterior view. Okay. Now I know what's front, what's back. I can try to imagine inserting this into someone's acetabulum. So if the head is located here, that means the body has to be located here. So the acetabulum should be here. Right? So this would be someone's right hip. Not right hip, right femur. Okay? Now, if you understand that, we can move on to looking at the different landmarks on the femur. This is the head of the femur. Fovea capitis is this indentation. This is the neck, femoral neck. Okay, now if you can see here, I think it's better to view it from the back. This is a greater trochanter, lesser trochanter. And you can see how there's a ridge between the two trochanters. This is the intertrochanteric crest. The crest is more prominent than the intertrochanteric line, which is in the front. This is the intertrochanteric line. Okay, so notice there are two different landmarks. Intertrochanteric crest, intertrochanteric line. Intertrochanteric line is anterior. Okay, the crest is posterior. The patellar surface is down here. Okay, where the patella will be located, just above. Okay, now if you look to the back, this line, this is the linea aspera. The lateral and medial epicondyles, so the epicondyles are next to the condyles. So if these are the condyles, okay, again, you have to first be able to tell if you're looking at the front or the back. So this is the front. That means this is the medial, this is lateral. Okay, because whichever the head is on, that's got to be medial. Body's right here, right? So this is a medial epicondyle and medial condyle. This is the lateral condyle, and the epicondyle is just right next to it. Okay. So I should point out too, this portion is the epicondyle. This portion is also the epicondyle. The condyle is the spartum portion. Okay. And then the intercondylar fossa, as I pointed out, is just the fossa or the depression between the two condyles. Okay. Moving on to tibia. Okay, we're going to pick the other side for now, just to practice. Okay. Now you have to be able to determine, is this right or left? And again, in order for you to determine is this the right tibia or left tibia, you have to have a landmark that lets you differentiate between front view versus back view. For me, okay, the easiest way to tell that on the tibia is first the tibial tuberosity up here, or the anterior crest, anterior border here. Those two things, either one, will tell you that this is the front view. Okay, whichever side doesn't have it, that's the back view. Okay, so now you're able to tell this is the front view. Okay, you have to be able to tell what is medial, what's lateral. Well, you should also note that like in your upper extremity, that smaller bone, right, ulna, located more medially. Okay, whereas in the lower extremity, your fibula is located more laterally. Okay, so this fibular notch will allow you to tell medial from lateral. Okay, so this tells you that the fibula is located here. And since fibula is more lateral to tibia, okay, that means the body has to be located here. Meaning this is the left tibia. Okay. So in terms of the different landmarks, okay, so this is the lateral condyle, medial condyle. Okay, so condyle are these rounded portions. This is just the facets of the condyles. Lateral condyle, medial condyle. Okay. The intercondylar eminence is right here. Tibial tuberosity, right here. The fibular notch is located on its distal end, where the surface that allows it to articulate with the fibula. And then this is the anterior crest, of course. And then this is the medial malleolus. Okay. Let's move on to looking at the fibula. Fibula, there's really only bony landmarks you have to know. Okay, so make sure you're able to tell the head from the distal end with the lateral malleolus. You notice that the lateral malleolus is more slanted than the head. The head also has a kind of subtle line located just under the head. Oh, sorry, I can't get rid of that. Okay, there's a line. Okay. So those articulating facets point medially. Okay, that lets you determine how it is associated with the tibia. Okay, since this facets are here, the tibia must be here, therefore this is the left fibula. Okay. Moving on to the tarsal bones. The talus, calcaneus. Okay, this big one here that's a cuboid. Okay, not lateral cuboid. There is no such thing as lateral cuboid. Okay, there's lateral cuneiform. Okay, that's cuneiform, not cuboid. Okay, so medial, intermediate, and lateral cuneiforms. Medial cuneiform, intermediate cuneiform, lateral cuneiform. Okay, and you can use the mnemonic we've talked about in class for those. These are the metatarsals. First metatarsal of the left foot, second metatarsal of the left foot, and so on. Your big toe has two phalanges. There's a proximal and there's a distal. For digits 2 through 5, 2, 3, 4, 5, each of them have 3 phalanges. Okay, so there's a proximal, middle, there's a distal. Okay, proximal, middle, distal. So this one specifically will be the 4th proximal phalanx of the left foot. Okay, and this will be the 5th distal phalanx of the left foot. Okay. This is it for lower appendages.